I'd like to begin this morning. We have some guests we want to introduce, as well as some internal announcements. I want to begin this morning. We have the Regional Director of the Department of Health and Human Services here, Kathleen Falk, who, although she drove in from Indiana for today's announcement, she's actually headquartered in Chicago. And I learned today for the first time she was an elected official, which makes her near and dear to my heart. She was
I thought I already was near and dear.
Yes, you are, but being an elected official makes you even more special. And that's she was the elected county executive in the county that houses Madison, Wisconsin for 14 years. So it's good to have you here. And with that, I'll introduce Director Kathleen Falk to bring us up to date on what's happening with the Affordable Care Act. And also Representative of St. Rita's, Jeanne Mooreman, and from the Health Partners of Western Ohio, Jolene, Joseph. Please come up as well. And please.
Well, Mayor, now that you've outed me from Wisconsin, we have an important football game coming up this Saturday. I don't need to remind people in Ohio. Yeah. So, thank you so much.
Good to have you back.
Thank you so much, Mayor. You wonderfully hosted us last year at this very important historic time in our nation, where we are reaching out to all the uninsured here in this wonderful community and in the state of Ohio to make sure they know about a really important opportunity that they have to get affordable health care. For some people, it'll be the first time in their lives or in their recent memories. And so everything we can do to get the word out, I'm so grateful for your leadership in helping get the word out. As I mentioned to you earlier, and it may surprise some here, but what the surveys are showing is that about 89% of the uninsured do not know we are in this important 3-month open enrollment period. That began November 15th and ends February 15th. So the mayor's efforts here to help get the word out in his community really make a difference. We have done a lot in the last year. We can stand here today and say that over 10 million more people in our nation have health insurance today than did a year ago at this time. That's very inspiring and very encouraging. But we also have more people to reach. There are still tens of thousands of people near and dear here who still do not have health insurance or have health insurance at a cost that is very hard for them to afford. And so we encourage them to come to the federal website and marketplace. The federal website's working to shop and see if there's some better plan that will serve them and their families. There are a number of new things this second open enrollment period. One is that this application process is much simpler, as these two fabulous women who will be talking now know firsthand. The application process now, if you go onto the website, is reduced from about 76 screens to 16 screens, making it much more consumer friendly. You will also notice here in Ohio that you have even more plans to choose from. In fact, there are 16 providers in the state of Ohio. You rank as one of the top states in the nation for the number of providers. That means for us consumers here, greater choice, and it also helps keep the prices low. More competition amongst the providers helps keep the prices low. And so there is a great opportunity for not only people who are new to purchasing insurance, but those who already have it. We encourage them to come back to the website and look again, because for next year they might find a better or more affordable plan for them. We also know that based on this first year's experience, how affordable this product is. The national statistics are that about 70% of those who have purchased insurance through this federal marketplace are getting this top quality insurance with 10 essential benefits for $100 or less a month. So it is worth checking out. Now, as I said, if this short enrollment period ends February 15th, but if you need coverage to start January 1st, you have until December 15th, which is not far now, in order to enroll. And there is help in a number of places. First, you can go to the healthcare.gov website. Not only is it working well, but to give you an illustration, a week ago during that first week of open enrollment, there were about 3.7 million visits to the website. You can also call the toll-free hotline 24 hours a day, 7 days a week, and that number is 1-800-318-2596. And that call center got 1 million calls in that first week. But if you want to talk to a real live human being right here in your neighborhood, you can go to these two places and other wonderful partners here in this community to get personal assistance, one-on-one or phone call assistance from them. And that is my cue to turn this over to these two great women who can describe some of the opportunities where you can get assistance right here. Thank you.
Jeanne?
Okay, thank you. At St. Rita's, it's part of our mission to make sure that the opportunity to enroll is just accessible. We've had 2 sessions, and we've partnered with Health Partners of Western Ohio. Jolene is here representing them. And where our first session was November 19th, and we have another one January 21st, where people don't need to make an appointment. They can just walk in, sign in, take a seat. And Health Partners of Western Ohio provided 3 counselors that would just welcome our guests and talk to them, find out what their needs were. We had computers set up and phone lines too, where they would just, a lot of these people may not have had computers at home, so they would just log in and help them decide maybe what plan would be right. If they weren't ready to make a decision that day, we could print off information they could take home. Or sometimes the counselors could even make a phone call and they could talk. But they were the mediator between, which made it a lot easier. We had about 42 people, I think, arrive on November 19th, and that was early in the sign-up period, so we were kind of happy about that. We're expecting even more on January 21st, and if anybody needs it, I have some flyers with this next session outlined on here. And we also have Kathy Harold in our Health Resource Center at the hospital, and she's available to take phone calls, and she coordinated these sessions, and she also can be reached, which is on this flyer, for individual assistance at any time, in between these sessions or wherever. So that's about it, I think. This is Jolene.
Great. Thank you very much, Mayor Berger. We are very delighted to be able to offer this service once again this year. We last year had approximately 9 certified application counselors within Health Partners of Western Ohio. This year we have added, and we're at 15, that is covering all 6 of our sites. So that way individuals in various communities have access as quickly as possible to a certified application counselor. And we are currently taking a lot of appointments because of the time and the number of plans, as Ms. Falk had addressed earlier in the session this morning, that it's going to take a little bit of time for consumers to really process and figure out which plans make the most sense for them and what is going to meet the needs that they have. But just to give you an idea of the work that has been done since we opened the Marketplace Exchange last year, from January through the end of November of this year, we've had 8,100 assists that we have spoken with consumers or talked with them about particular plans, whether that's the Marketplace or Medicaid expansion. We've completed 3,130 applications, and that is a combined Medicaid or Marketplace. And we have assisted through that coverage, whether it was the Medicaid or the Marketplace, 3,789 lives have been covered during this basically 11-month window. We have consumers now available 8 to 4:30 at all of our sites. 441 East 8th Street, and then also our quick care site on North Main Street here in Lima. We have at least 7 individuals that are available as CACs to assist here local. And then we have places in other counties and communities that we are also assisting. We will be opening up evening and weekend hours within 2 weeks at our quick care site. Since we're open there Monday through Saturday, 8 a.m. to 8 p.m., we will also be offering some evening and weekend hours so individuals who are working will have access to a CAC to assist with the process.
Just because I haven't applied for this, a typical applicant would need what, an hour?
Typically, that would be the average, I would
Okay.
say. As long as they have brought all of their resources in with them, an hour should be sufficient to go through not only the application itself, but also then looking at some of the plans. The website is much improved, as Ms. Falk had indicated, because now it breaks down based on your income. You don't have to go through 150 plans if that's what is really brought to your attention. It breaks it down by income per month of what you would pay. So if I say basically my budget is only $200 a month, that's what is affordable to me, then I can look at those plans that fall within that particular category, and I don't have to look at dozens of other ones that really would not be applicable to me. So that has really expedited that particular process. And I can tell you, we have seen a dramatic difference here locally. Health Partners of Western Ohio was running at about 40% uninsured rate for our patients that we see. We are now at 20% uninsured within our organization. So a huge difference that we have been able to identify by just opening the gates to allow individuals access to health coverage.
That's terrific. Jeanne, is there any kind of measurement of that kind of an outcome?
I don't
that
have
same
those
area
numbers
is
with
in?
me today, so
Great.
that's the goal.
Very good. Director, anything more that you want to add?
Yeah, just one little,
Step.
one little thing, which is that, you know, for many of the uninsured, they have been uninsured for so long for two primary reasons. One, they have a pre-existing condition, you know, cancer or diabetes or something that made it impossible, literally, for them to buy insurance because no insurance company would cover them. Or they could buy insurance, but it was so expensive given their condition that they really had to sacrifice in order to pay for their health insurance. And so what we have found is that the statistic about 89% of the uninsured not knowing this open enrollment period exists is because they never thought they could be getting health insurance. And that's why it takes several visits to one of the assisters for them to learn about what health insurance is, what kind of choices they have, and how to go about using it. So it's a complicated process and takes several visits to an assister, and why it's so great. Again, thank you, Mayor, for providing the leadership here to help get the word out.
Good to have you here. Thank you all.
Thank you.
I'll just mention that my recollection is that the principal reason for personal bankruptcy, the largest single reason people file for personal bankruptcy is medical bills. And of course, when somebody files bankruptcy, it's a personal trauma for the family, but it also has these waves of impact on everybody that's been affected by the fact that they're shrugging off their bills. So when you think about the kind of help that the Affordable Care Act represents, it truly does encourage people to take care of themselves, because now going to the doctor is affordable, but it also has the impact of hopefully preserving their financial circumstances as a household, that they can remain in good standing with everybody else that they happen to owe money to. So I think that the long-term impact here is obviously measured in a number of ways, one of those being the health of the individual or the family, but also the economic health of the community. And I want to thank you locally for the outreach to the community. They say that it normally takes 6 times for a person to hear a message before it breaks through all the clutter that we're all dealing with. And of course, the other thing they say is McDonald's advertises not because we don't know that they sell hamburgers. Okay, so I mean, there's lots of competing messages. So the idea of 90% of the folks truly not being aware, not even considering it, all those kinds of things, it's really important that we're explicit in this kind of outreach, and we do make it clear that there are resources where people can personally have their their questions answered. So, Director, thank you for coming back to Lima. And ladies, thanks to St. Rita's and Health Partners for the outreach. Also this week, on Monday, the city started a new relationship with Allen County Refuse, which is, they are now our garbage and refuse collection provider. And here today, Gary Shealy, the Utilities Director, and Aaron Wright are here to talk about what started on Monday and what we hope will go forward for the next 8 years, with a superior level of service being provided to households within the city. Gary?
Here. First off, I'll say this is the result of probably the last 7 or 8 months of effort. We bid the contract, and I think that's all been out in the news media and so forth. And as the mayor pointed out, this past Monday, we actually started a new service for the next 7 years with Allen County Refuse. Aaron Wright is the general manager, or co-general manager, I guess it is. You get your title right here. Owner, like that, wherever. The guy does everything. Yesterday, I was out on the street. He was actually running the machine. He was actually picking up a container. I was impressed. I thought he might have put it through the side of a car or something like that. But anyway, because we started the service, one of the things we noticed initially in the street, that Aaron will pick up here in a few minutes about what he's experienced, or at least over the last 2 days. The day of service has not changed. We made a very conscious attempt to basically say, residents, if you're serviced on Monday, your service is going to be provided to you on Monday. But what may change in a lot of locations is the time that the vehicles are on the street. I know in my neighborhood, I'm used to basically setting my trash out at 7:30 or so, right before I leave to come to work, but the truck didn't get there till about noon or so. And now the yard waste truck was always there right at 6:30 in the morning. And then so I kind of got behind the 8 ball myself, and next thing you know, I look down the street, and there goes the truck down the street, and my containers are still over there in the garage. And that's happened in a lot of different neighborhoods. I know out where I live, that was principally, and I'm frank with you, even the president of council says, I'm not used to getting up that hour in the morning setting my trash out, but the message here is that you need to have the trash out no later than 6 a.m. of the morning of the service. You can set it out at 6 p.m. of the day before. That ensures that when the service vehicles come down the street, that your service will, in fact, the house will be serviced. If you do not have them out there, they're not obligated to go back and get them. You'll have to wait until the next week when they do come back around. And again, normally the trucks, there's 3 trucks on the street at this point in time. There's a yard waste truck, a garbage truck, and a recycling truck. Not all those are going to come at the same time, but you have to have the material out, setting at the curb, or if you're a hard stand, have it accessible before 6 a.m. of the morning to ensure that you're being serviced. The other thing I will point out that has changed is the transfer location. This is the capacity for residents to bring upwards of 3 cubic yards of material in their pickup trucks or their trailers. Under the prior contract, that was over on Broadway Avenue. Now the Allen County Refuse site is at 4th and Metcalf. It's the basically it's 1400 South Metcalf. It's the building that basically sets right at the end of 4th Street where it runs into Metcalf Avenue. It's the structure right there. That's where residents can bring that material out. They are not to go back to Broadway. Aaron?
Thank you. The idea of the cans is to put them out at 6 o'clock the night before. Naturally, they are covered. We don't have to worry about rodents and stuff getting into them, other than the idea that the cans are, from efficiency standpoint of being able to dump the cans, and trucks can pick up multiple stops instead of the olden days of guys getting out of the trucks and dumping them in. Back, healthcare, it all comes into play with these automations that we got today. So I will tell you that things have started out very well. Our first day, I think we had upwards of about 5 stops missed out of 3,000 stops that were in the city, just to give you an idea. We have implemented a complete computer system. Within that computer system, the trucks are all routed. That being said, the drivers might start at one side of town, go clear to the other side of town, and only pick up the right-hand side of all the streets. As the day proceeds, 4 or 5 hours later, they come down the left side of the street, and they'll be picking up those sides. We are getting a lot of calls from people saying, well, these cans were picked up, but mine wasn't picked up, and they're talking about the other side of the street. So just to save yourself some time, just wait till the end of the day before you call if you feel you have been missed. I can tell you, though, every stop is in our computer, and we are checking off on every single one that's being picked up. Towards the end of the day, we know how many stops are not going to get picked up. We have extra drivers that go out and help finish up the routes for whatever reason, just to give you an idea. It has started off very well. We are currently running natural gas. We have the filling station. It is operational. We're in the final processes of our credit card reader. All the trucks are being filled right now with natural gas. And I can tell you that in the next couple of weeks, we hope to be entertaining other people that would like to buy natural gas for their fleets. And we have some outside trucking companies that would like to stop in and buy fuel from us. So if there's anybody with the thoughts and you would like to have an understanding what natural gas can do for your companies, please give us a call. We'll take you through the process. I can promise you, you might be surprised when you see the numbers. So just to give you an idea. As for the leaf pickup, the recycling and the residential waste, would you please keep the cans separated? These are automated arms. The guys come through. And what happens is everybody tries to put everything side by side. Naturally, when the hands reach in, it knocks the other containers over. I can tell you from firsthand experience, I ran it for 3 hours the other day, and I'm not saying I'm the best, but I did knock over a couple cans, so thank you.
What I might invite the media to do is actually to go visit the Operations Center. The technologies that Aaron described are new. The trucks are being dispatched and tracked on GPS, plus as they go past a given residence, if somebody has not set their materials out, the driver hits a button and it's noted. All of it is also videotaped along the route. So there's a lot of I think, forethought in the design of the services that are being provided. We do have to basically get used to the new systems, however, and I think what Aaron described as the routing, that is Allen County Recyclers' choice as to the routes they run. They're not, we haven't stipulated under the contract that they must run the routes as had been the case with Allied. So, but we all have to get used to that. So the time of day, the pickup routines, all those kinds of things will take us a couple of weeks, I think, till everybody kind of settles down and knows what will be happening. But thank you both for the information this morning. Brett Roehm is here from the Parks Department with an update on our youth basketball. This was, as I understand it, a huge success on this year's scheduling.
Yeah. Here today to announce that this coming Saturday is the kickoff for our Youth Basketball League. 3rd through 6th graders, Western Ohio Youth Basketball League will kick off this Saturday. Youth participating in this league are from the following schools: Bath, Elida, Lima City Schools, the Lima Catholic Schools, Perry, Shawnee, Spencerville, Temple Christian, and Walpock. All of these games begin at 9 a.m. on a Saturday morning, and we are done for the day. The last game begins at 2 p.m. This coming Saturday, there's 37 games based in various locations. Our host sites, we have 13 host sites, or various host sites throughout the area. Season will run through February 7th. With the number of teams that we have this year and in past years, we have an end-of-year tournament for the 5th and 6th grade only. We don't have enough gym space to do a 3rd and 4th grade tournament. But the season will wrap up with tournament and everything by the weekend of February 21st and 22nd. All said, on any given Saturday, there'll be 76 youth basketball teams playing in these various locations. If anyone's interested in seeing a schedule, it was about 10 days worth of work trying to get this all ironed out. You can get one at our office, but chances are you're bound to know somebody's participating in this league with a number of kids. So on any given Saturday, there'll be about 700 kids flying around the area here, surrounding
It's
area.
about 10 per team, so it's about
Yeah, it's pretty
800.
close. Well, it varies a little bit, but yeah, we try not to go over 10 per, more than 10. So
Very
Thank
good.
you.
Congratulations on the
Thanks.
recruitment. Lots of little LeBron Jameses out there, we hope. Also, Amy Odum, Director of Department of Community Development, is here with an update on a new loan product that we're offering.
Thank you, Mayor. The City of Lima is proud to announce that we are expanding the dollars available for home improvement in the City of Lima. The city is taking our current home update program and increasing the dollars available from $15,000 to $24,000 for home loans for repairs to low-income homeowners. Basically, to be eligible, a person needs to be at the 50% or below of area median income. In Lima, that means, and that's based upon household, so in Lima, if it's a single person who is a homeowner, if their income is $19,200 or below, they may be eligible. A family of four, an example would be an income of about $27,400 or below. They would be eligible for this product. What is interesting about it is that it is basically a self-amortizing loan. If this person lives in the property for 5 years, keeps it insured for 5 years, there is no payback on this loan. It is an interest-free loan. And so each year that a person resides in the home, the dollar amount that they owe back to the city decreases. If they sell the home or they leave the home or no longer use it as their primary residence, there is a payback on that loan. This loan is to help those with serious health and safety problems in their homes. That would be such as broken water lines, sewer lines, gas lines, no heat source, or major roof damage that is really affecting this health and safety of the persons in that home. The other new twist to this product is not only do we want to offer home repair assistance, we want to offer budgeting and wealth prep assistance. In a partnership with LACA, anyone who applies for these loans will be offered wealth prep classes through LACA to assist on budgeting, to assist on looking at what can be done to make this house sustainable after the home is repaired. If anyone is interested in applying for this product, which is called the Home Update Loan, they are welcome to contact our offices, the Department of Community Development, or the application is online. I guess I'd like to reach out to all of you who may be viewing this today that if you aren't eligible, you may very well know people who are. It is amazing to me that people forget that the elderly who are on fixed income, your grandmother, as I constantly have to say, may be eligible for these kinds of products, and you may not be aware of it. There are other persons on fixed incomes that very often are overlooked when we make these products available. So we'd like you to give us a call. The City of Lima, through our consolidated planning process for our home and CDBG funds, have made funds available for about 20 of these loans this year. And so we look forward to hearing from you and ask you to tell a friend and share the information. Thank you.
And lastly, representatives of the Y are here, Terri Averisch and Drey Wright, for announcements about Christmas and aquatic programming at the Y. Terri.
Thank you, Mayor. Every spring, we run a Splash Learn to Swim program for youth and preschool age youth in the area, and it's become very popular, and we started last year offering it in December. This year it's going to be December 15th through 19th. We have Junior Splash for age 3 to 5 and the regular Splash program for age 6 and up. Recent American Red Cross states that only 39% of parents say that their children can do the basic water safety skills like floating and jumping into water and swimming 25 yards, exiting the pool without using a ladder, treading water. So it's really important to help yourself be pool or be able to handle a pool or open water emergency. The National Drowning Prevention Alliance says that drowning is a leading cause of death for children ages 1 to 5, and the second leading cause of death for children, unintentional injury-related death for children aged 1 to 14. Ohio is one of the top 10 drowning states, so taking part in formal swimming lessons and water safety classes can reduce the risk of drowning by 88%. So this is a great time for kids to take advantage of these lessons. It's just 1 week long, and we do it as a community service. It's $5 for 5 lessons, so it's very affordable. It again is December 15th through the 19th, and we hope to get a full class. We'd like to get everybody registered by the 13th, so we know how many instructors to have for that program. And then also, I just wanted to thank the community for all its support. The Lima YMCA is a private nonprofit organization, and we have support from the city and support from individuals. I'd like to remind people that at Christmas time, a membership is a great gift, or gift certificates can be used towards membership, or massages or things like that. And also, the YMCA does offer financial assistance for anyone in need, feels like they could really utilize a YMCA membership, but they just can't afford it. Providing they give us their income information, we sponsor from 20 to 80% of the membership cost. So if anybody is interested, please contact me at the Y, and I can let you know more information.
Very good.
And this is Drey White. He's our Health and Wellness Director.
Thank you, Terri. I'm just here to talk about a few upcoming programs here at the Y. The first is our Breakfast with Santa. Breakfast with Santa is coming up this Saturday.
Is that a healthy breakfast?
Yes, of course. On Saturday, December 6th, from 8:30 to 10:30. It's a great event for the entire family. They can eat a healthy breakfast, meet Santa, and play games. So reservations are $2 for members and $4 for non-members. The second event is our Parents' Night Out, our Youth Christmas Party. That's coming up. That is December 12th, so next Friday. It's a great opportunity for parents to finish up Christmas shopping and allow the kids to be at the Y. The kids will be making crafts. They're also going to be eating pizza, meeting with Santa, so it's a great time for them. They will be swimming as well. The fee for members is $5 and members is $10. And we're just asking for registration to be done by December 11th. And last is our annual group exercise party, which is coming up January 3rd. This will be free for members, which is great, and $6 for non-members. It's just a great opportunity for members and non-members to try out some of our group exercise classes. They'll be offered in 30-minute samples. You can bring a friend, and they can try out your favorite class. So, babysitting will also be available. So if you have kids, babysitting services will be available for that as well.
So what are the range of exercise classes?
Very wide range. We'll be offering as many as we can. All of our Les Mills classes, Silver Sneakers is a great class for the seniors 65 and up. So
Was that intended for me?
No, not necessarily. No. So.
All right, very good.
Thank you.
I needed to pull your chain a little
Yeah.
bit. Very good. I believe that's all that we have for today, so we'll appreciate your time today. We'll break down for interviews. Thank you.